how are we? You're looking great for 10-year-olds. Not a day over, don't look a day over 8. Look, I'm delighted to be with you and delighted also to acknowledge that we are on the lands of the Whadjuk Noongar people. We are so blessed to be able to share this country with them. So let us take a moment to acknowledge their elders past and present and give thanks for sharing this country with them. Can I also just take the opportunity to say thank you. Thank you for the work that you do. Thank you for the incredible passion that you bring to your workplace. And I'll explain the reason why. As you know, I began my life in politics as the Shadow Minister for Health. I was elected in 2008 and had the opportunity to, from there on, to start to learn the ropes of health policy and the important role that health plays, not only in terms of providing us with a quality of life, but in providing equality of opportunity of life. And that is, it's not only an important thing for the individual, it's important for all of us to provide an equal society in which we can all share in the prosperity. And we can't share in the prosperity of this country unless we all share a quality of healthcare at the same time. And I learned very early on the importance of primary healthcare. And that is that journey that you travel on with your local GP, your local healthcare professional, your local clinic, in making sure that you provide for your ongoing health needs, so that you don't continue to develop chronic disease and and experience episodes of unplanned care, because you've got that great relationship with your local doctor and with your local healthcare professional and allied healthcare professional, and the important role that primary health provided. And of course, I was the Shadow Minister for Health. I was into hospitals. I was into talking about how big hospitals and how good hospitals are, which is what state governments do. But of course, what I was really wanting to talk about is the important role that primary health plays. And I want to tell you about the important person that came into my life at that time, and that was Sel. And he came to me one day to say that he was establishing a primary medical clinic. I think it had something to do with Dr. Prabha's concluding medical studies. And from that time on, I started my journey in understanding the important role of primary healthcare with you. So my journey as a politician is intertwined with the Park Medical Group. Now, I had the great privilege of serving in the role of either the Shadow Minister for Health or the Minister for Health for 15 years. And it was a time that I greatly cherished, because I believe that healthcare is fundamental to the quality of life that we all lead in terms of our community. And I want to acknowledge Sel and his family for being such an important part of that journey and making sure that we understand how important it is that we continue to provide quality healthcare. And this was innate in me. My grandfather was the local GP where I grew up. My father took over the clinic from him. But it was deeply entrenched in that traditional idea of what primary healthcare represented. And what we all saw, particularly through the early 2000s and onwards, is how primary healthcare is continuing to change in our community. And when Sel and his family took over the Park Medical Group, primary healthcare was in a pretty bad space. There was many GPs that believed that there simply was not a way that you could bulk bill a patient and continue to provide a thriving clinical service. There was a period of time there where people simply thought that primary healthcare was dead and that it couldn't thrive in our community. And Sel and his family proved that wrong. And you've all proven that wrong. 10,400 new patients over the course of the last financial year has proven that that was wrong, and that we can provide quality medical care in the community, providing that great closeness that primary health provides to the patient, that contact, that familiarity, that frequency, which ensures that we continue to make sure that people live great great lives, protecting their health as they go along. And so you're 10 years old today. And I believe that, I've gone on that journey with you, watching you grow up from that clinic in, to be quite frank, that funny little building out the front of the Victoria Park Shopping Centre, where you not only, managed to survive, you thrived. And then, of course, the clinic further down the road in Albany Highway, and now the Waterford Clinic, which I had the absolute privilege to open with you all to celebrate the next step of this great medical practice. And so I want to be here today to thank you for guiding me on the journey that I've been on as not only the Shadow Minister for Health, but the Minister for Health, and now as the Premier of Western Australia. I am so proud of the care that you provide to the community in which you live. So proud of the fact that you have kept alive the very values of primary health care. And so proud of the fact that in a small part south of the river, thank you, Sal, small part south of the river, we are seeing excellence in primary medical care. And I understand that you continue to grow that, not only in terms of the incidence of care, but the scope of care, and that you're growing that beyond just the GP services, but obviously other areas of physiotherapy, audiology, occupational therapy, and so on. And that's an important part of what you do as well. So thank you very much, everyone, for the opportunity to be with you tonight. I want to acknowledge you, but I also want to thank you. I've been on this journey with you all, and I really thank you for the opportunity to have done that. You've informed me in my life as a politician and as a Minister for Health, and I'll continue to watch with absolute interest the ongoing work of the Park Medical Group. Here's to the next 10 years. Happy birthday, everyone.